Hi, this is Dr. Rocker again. I'm here with Tracy. And Tracy, we did a repeat procedure on you a couple of weeks ago, 2 to 3 weeks ago, I believe it was.
Yep.
And we did a number of different things. We did some Botox. We did about 40 units of Botox in the upper face, where we treated the forehead, glabella, and around the eyes.
Because I have that really bad 11 there, and I was getting it really bad here. And I think, is that from sitting at the computer? Is that why I'm getting that so bad? Or
Well, yes. I mean, those wrinkles and lines happen because of repeated muscle contraction over time. And so if we tend to be intense and do this, or we get angry from time to time, you know, it can intensify those lines a little bit. A lot of it's genetic, of course. You just look at your parents and see what they look like, and you have a pretty good idea.
it just gives you a confidence booster that I don't think people really give themselves enough credit for, that it's okay to do that.
Right. Well, you know, a lot of times, it's just fear. People are fearful of having a procedure or something like this done. A lot of people think about it. They go, "Gosh, you know, I'd love to have something done. I don't want to have surgery. I don't want to be cut.
Right.
I don't want that sort of thing done. But if there's something to be done to just make me look a little bit more youthful, kind of like I did 5-10 years ago.
Just not so tired. That's what I noticed.
Right.
Everybody's like, boy, you look like you got a really good nap all of a sudden. And that made me feel good, too, that it's not real drastic.
And what I do is when somebody comes in and we take a look and we do a consultation, and I'm able to talk about different things that we can do. Right. And then together we make a decision as to where we want to go. One of the common questions people ask is, well, how often am I going to have this done? You know, because it's important. Well, with Botox, if we've discussed before, that's something that really needs to be done every 3 to 4 months. There's a few people that can go longer than that, but for most people, it's every 3 to 4 months. So,
and that's because it prevents. After that point,
yes,
it's preventing it?
It's because of the way Botox works, in that the body metabolizes the Botox after 3 months or so the muscle function comes back. And remember, it's the muscle function that causes those wrinkles over time. So if you're able to relax those muscles, the wrinkles can't form. So if you stay up on the Botox, not only will it stop the wrinkles, over time, by keeping those muscles relaxed, they atrophy a little bit. In other words, they get a little bit smaller. They're not as strong. And down the road, you may need less Botox and do it less often. But to start with, usually for the first couple of years, you really should come every 3 to 4 months. Then the second phase, usually, is we talk about filler. 2 major types of fillers that we use at Skinology. One is Radiesse, and Radiesse is calcium hydroxyapatite. Now, that's essentially the same material that's found in your teeth and in your bones. Tiny little microspheres. It's in a gel matrix, and that is a little bit stiffer, a little bit longer lasting than the hyaluronic acid products, which are Restylane and Juvederm. But what I use Radiesse for primarily is foundational work. So when I take a look at somebody and I see that the fat pads in the cheeks have fallen, gravity has taken hold a little bit, I said, well, what we want to do is we want to lift everything back up, because, everybody looks in the mirror and they go, gosh,
if I could just
do this, it looks so much better. And that's essentially what we do with Radiesse. So typically in the cheeks, I will lay Radiesse down on the bone, and that's what it does. It pulls everything else. You kind of get that supermodel look a little bit with the cheekbones that everybody desires, And it works great. And we add a little anesthesia to it, and it's amazing how little it hurts.
That didn't hurt a bit. I don't think anything you did really hurt.
That's super, and that's the experience of most people. So that's how we use Radiesse. But I can also use Radiesse in a number of other ways too. Radiesse is very versatile in terms of filling larger defects. That's a tough word, defects. But if you have some hollows in the temple, we can put Radiesse in there, and that's very, very helpful. We can actually build the eyebrow a little bit as well. You can use Radiesse in the nasolabial folds. I'll do that sometimes for people that need a little bit more support foundational work. Around the oral commissures also is a place to put that as well. But you can use Radiesse in the hands to cover up. If you have veiny hands, you can put Radiesse in there, and it works well to do that.
I didn't realize that.
Yeah. The other type of filler that we use is hyaluronic acid. And hyaluronic acid is, nobody's ever had an allergic reaction to hyaluronic acid. Everybody tolerates it. There's no lumps or bumps. It's very versatile, very easy to use. The one that we like is Juvederm. And Juvederm comes in a regular formulation, which was original, and now it's also in something called Ultra Plus, where it's a little bit thicker, it's cross-linked a little bit differently, it lasts a little bit longer, and we use that a lot in the nasolabials. But again, Juvederm can be used pretty much anywhere.
Is that what you used in the lips?
Yes. One of, probably the thing that I enjoy the most out of everything I do here at Skinology is probably doing lips. Now, we refer to it as lip augmentation, but I don't know that that's really a good term. What I like to concentrate on is what we want. Most people, the reason they get their lips done is not really because they want them bigger. Now, some people do. But what bothers most women is they get these fine lines and wrinkles on the top of their lip, and when they apply their lipstick or something, it bleeds in the little lines. And
then we really look like our mothers.
And so that's what they don't like. And so what I like doing with the lips is really defining the lip border, the line, and we'll do augmentation as well. In terms of, as we age, typically our lips get a little bit thinner, and they may need a little bit more volume. But, and I really don't enjoy making people's lips big.
Now, will you tell somebody that? Will you say?
I do. I tell them, I say, I don't like that. I don't like, people with, and most people don't. Most clients that come in that want their lips done, the first thing they say is, I don't want lips like that.
Make it look natural.
Make it look natural. And that's what we do here.
So you can actually do a lot of plastic surgery almost without the surgery. With this, you can restructure and help without going under the knife.
We use the term, or has been used, and we sometimes use it too, liquid facelift.
Yes.
And it's just doing things via injectables without cutting and stretching
and that made
the
me
skin.
feel better.
And there's not anything that we do here at Skinology that you can't have done over lunch and go back to work afterwards if you want. You can go out to dinner if you want. The worst thing that's going to happen is you might have a little bit of swelling afterwards, sometimes a little bit of bruising.
Well, I think that goes a lot to say, though, with the trust factor. I think that, like you had said before, you have built a family practice in the area, and people do trust your opinion. So that might be a reason that more and more people are coming, because they trust what you're going to say. They know they're not going to walk out and have somebody laugh at them.
Well, I think another thing that we were getting to earlier is, like when we did a consultation with you, I thought maybe we should use 3 syringes of Radiesse. We were going to need 3 syringes of Radiesse to get accomplished what I thought we needed to accomplish, along with doing a syringe of Juvederm in your lips. Well, it turned out, while I was doing the procedure, I'm like, you know what? I don't think we need to use this extra syringe of Radiesse, and so the procedure became cheaper. It was less expensive because we didn't need to use as much product. I am not going to say and put extra product in your face if I don't think it's necessary. We don't do that here, and we have lots of times I'll see something and I say they'll want something and I'll say no, I'll refuse to do it because I just don't think it's necessary, or I'll just try and talk them out of that. Or a lot of times I say, you know what, why don't we give that another 6 months and then take a look then, and then I think maybe you'll be ready for that. It's a team decision, a group decision. I talk with the client, we have a discussion, we talk about options, what my recommendations are, what your budget is. That's an important thing, and we come to a decision. And so when I recommend a certain package, and there's a price with that, I like to be able to do it all at the same time.
One other thing with special occasions, we all saw the Kardashian wedding, and, the mom went under the knife and had all this stuff done. That put aside, if you do have a special occasion, how far ahead of time should somebody come to you?
That's a very good question. That's a very good question. a minimum of 2 weeks. You need to give yourself a minimum of 2 weeks. I would recommend a month before. Right. Because a lot of times people are, oh gosh, I want to get this done. With Botox, you can do the 2 weeks. With filler, I would say give it 30 days. And the reason for that is just in case you have a little bit of bruising.
Right.
If you have a little bit of bruising, usually it's gone in 2 weeks, but just in case, if it's a real special occasion and you're looking to get some facial rejuvenation done, give yourself a 30-day window.
Well, I want to thank you so much for making my 50th birthday.
It was
very
a pleasure.
Special.
It was a pleasure.
And if anybody has any questions, now I know they can send in emails to you, they can call, we'll post the phone number on here, because a lot of what I understand, you actually have people that contact you for questions, and you'll give generic, that you can't give a full consultation through an email.
Right.
But they can contact you that way. The best way would be to stop by and just come in and see the girls and ask questions. So, correct?
Absolutely. Yeah.
Okay. Well, I appreciate that. And
it was a pleasure.
All right.